In today's medical breakthroughs, one treatment is garnering significant attention in the fight against spinal muscular atrophy, SMA, Risdiplam. This revolutionary therapy is transforming the landscape for patients with this rare genetic disorder, offering newfound hope and improved quality of life. Understanding the challenges of treating SMA. Spinal muscular atrophy, SMA, is a rare genetic disorder that affects the motor neurons responsible for muscle movement. It is characterized by progressive muscle weakness and atrophy, leading to difficulties in mobility, breathing, and swallowing. Historically, treatment options for SMA have been limited, with most focusing on managing symptoms rather than targeting the underlying cause of the disease. What is Risdiplam? Risdiplam is a breakthrough medication developed by leading pharmaceutical companies specifically for the treatment of spinal muscular atrophy. It belongs to a class of drugs known as SMN2 splicing modifiers, which work by increasing the production of survival motor neuron, SMN, protein. This protein is essential for the development and maintenance of motor neurons, the cells responsible for transmitting signals from the brain to the muscles. The mechanism of action of Risdiplam. Risdiplam works by targeting the underlying genetic cause of SMA. It does this by increasing the production of SMN protein, which is typically deficient in SMA patients due to a mutation in the SMN1 gene. By increasing SMN protein levels, Risdiplam helps to compensate for the genetic defect and supports the development and function of motor neurons. The unique mechanism of action sets Risdiplam apart from other SMA treatments. Unlike previous therapies that require invasive procedures or frequent hospital visits, Risdiplam offers a convenient oral dosage form. This makes it more accessible and easier to administer, particularly for young children or individuals with limited mobility. Clinical trials and results of Risdiplam. Risdiplam has undergone extensive clinical trials to evaluate its safety and efficacy in treating SMA. These trials involve patients across different age groups, ranging from infants to adults, and have shown promising results. In one clinical trial, infants diagnosed with SMA type 1 who received Risdiplam demonstrated significant improvements in motor skills compared to those who received a placebo. The treated group showed greater muscle strength, improved motor function, and increased survival rates. Similar positive outcomes were observed in clinical trials involving older children and adults with SMA types 2 and 3. Risdiplam was found to effectively slow down the progression of the disease, enhance motor function, and improve respiratory function. These improvements translated to a better quality of life for patients and their families. Benefits of Risdiplam over other SMA treatments. Risdiplam offers several advantages over other SMA treatments currently available in the market. Firstly, its oral formulation eliminates the need for invasive procedures or frequent hospital visits, making it more convenient and accessible for patients. This is especially beneficial for young children or individuals who may have difficulty with injections or infusions. Additionally, Risdiplam's targeted mechanism of action sets it apart from other treatments. By increasing SMN protein levels, Risdiplam addresses the underlying cause of SMA, rather than merely managing symptoms. This targeted approach has shown significant improvements in motor function, respiratory function, and overall quality of life for SMA patients. Furthermore, Risdiplam's efficacy has been demonstrated across different age groups and SMA types. This versatility makes it a promising option for a wide range of patients, offering renewed hope for individuals with SMA and their families. Risdiplam availability and prescription process. Risdiplam has received regulatory approval in several countries for the treatment of SMA. However, availability may vary depending on the region. In most cases, Risdiplam is available by prescription only and must be prescribed by a healthcare professional experienced in SMA treatment. Before prescribing Risdiplam, healthcare professionals will assess the patient's medical history, SMA type, and current treatment regimen. They will also consider any potential drug interactions or contraindications. Once prescribed, patients can obtain Risdiplam from pharmacies or specialty clinics. It is important for patients and their families to work closely with their healthcare team to ensure proper dosage, administration, and monitoring of Risdiplam treatment. Risdiplam's multifaceted applications. Risdiplam has demonstrated remarkable effectiveness in the treatment of various types and stages of spinal muscular atrophy, including Type 1 SMA. Also known as Werdnig-Hoffmann disease, it is the most severe form of SMA that manifests in early infancy. Risdiplam has shown significant improvements in survival rates and motor function in infants and young children with Type 1 SMA. Type 2 SMA. This form usually manifests in early childhood. Risdiplam has been instrumental in improving motor function, increasing muscle strength, and enhancing the overall quality of life in individuals with type 2 SMA. Type 3 SMA, also known as Kugelberg-Wellander disease, it manifests later in childhood or adolescence. Risdiplam has shown promise in stabilizing or improving motor function in individuals with type 3 SMA. Shedding light on potential side effects. While Risdiplam has shown overall safety and efficacy, like any medication, it may have side effects. Common side effects include nausea. Some individuals may experience mild to moderate nausea, especially at the beginning of treatment. Fever and respiratory tract infections. These infections may occur, and it's important to monitor any signs of respiratory issues. Diarrhea. Mild gastrointestinal disturbances, including diarrhea, have been reported in some cases. It's essential to notify a healthcare professional if any side effects persist or worsen. Risdiplam, pioneering the future of SMA treatment. Risdiplam represents a significant advancement in the treatment of spinal muscular atrophy. Its innovative approach of modifying gene splicing to enhance SMN protein production offers hope to patients and their families. As research continues and medical science evolves, Risdiplam remains a beacon of hope for individuals battling the challenges of SMA. With ongoing advancements and a deeper understanding of its potential, Risdiplam could pave the way for even more targeted and effective treatments in the future. Risdiplam dosage and administration. The dosage and administration of Risdiplam will vary depending on the patient's age, weight, and specific SMA type. Healthcare professionals will determine the appropriate dosage and provide detailed instructions on administration. Risdiplam is typically administered once daily, either with or without food. The medication is available in liquid form, making it easier to administer to young children or individuals who may have difficulty swallowing pills. It is crucial to follow the prescribed dosage and administration instructions carefully to ensure the maximum benefit of Risdiplam treatment. Regular checkups and monitoring of SMN protein levels may also be required to assess treatment effectiveness. Potential side effects of Risdiplam. Like any medication, Risdiplam may have potential side effects. The most commonly reported side effects include fever, diarrhea, rash, and respiratory tract infections. These side effects are generally mild to moderate and can be managed with proper medical care. It is important for patients and their families to discuss any concerns or potential side effects with their healthcare team. They can provide guidance on managing side effects and adjusting the treatment regimen if necessary. Conclusion: the future of SMA treatment with Risdiplam. Risdiplam is revolutionizing the treatment landscape for spinal muscular atrophy, offering newfound hope and improved quality of life for patients and their families. With its targeted mechanism of action, convenient oral dosage form, and promising clinical trial results, Risdiplam represents a significant breakthrough in SMA treatment. As the availability of Risdiplam expands, more patients will have access to this life-changing therapy. Continued research and development in SMA treatment hold the potential for further advancements and improvements in the future. With Risdiplam leading the way, the outlook for individuals with spinal muscular atrophy is brighter than ever before. In the dynamic landscape of medical advancements, Risdiplam stands out, showcasing its potential to transform lives. Its efficacy in managing spinal muscular atrophy has been well documented, making it a crucial tool in the battle against this debilitating disorder. However, each individual is unique, and consulting a healthcare professional for a personalized assessment of suitability and dosage is paramount. Risdiplam's journey is a testament to human ingenuity and the relentless pursuit of enhancing lives through science. As we move forward, Risdiplam is likely to continue breaking barriers, offering hope and relief to individuals grappling with the challenges of spinal muscular atrophy. Thanks for watching.